I guess in the last year, I've had some successes with grant applications, both as principal investigator and co-applicant. And also, it's last year has been the time when a lot of my existing projects reached the point when we could report on findings and results, which boosted my publication record. So I guess those are the most likely things that have contributed to me being nominated. But perhaps I could answer your question differently, because the nominations are individual, but in my experience, research, especially in research centers, is not individual at all. So the reason I've been nominated is in no small part because I work in an excellent team with really collegial and supportive colleagues. It's also because I've worked with senior academics and researchers that have given me opportunities to lead on research, to apply for grants, to write for publication as the first author. And without that support, without those opportunities, quite often, or especially from senior women in academia, that nomination absolutely would not have been possible. So there's many things that I really enjoy about being a researcher. But I guess the main thing I'd say is conversations, especially conversations with service users or patients, either as part of data collection work, such as interviews, or as part of public engagement work. I've felt so privileged to capture voices of seldom heard from groups in particular. So, for example, I'm currently conducting a project with colleagues in Brazil that involves talking to people living with dementia on what good death with dementia looks like. And before starting this project, I've been really surprised that these conversations haven't been had. There's been quite a bit of reticence of talking to people living with dementia or about death. So having a chance to meet people living with dementia, to hear from them how important it's been to have their say. I think in one of the team meetings, I've described it as a bone deep research joy, and it's really been that. So yes, conversations, I guess. So there's a couple of new projects that have either just started or are starting soon, and it's tricky to pick. But I guess one I could mention is that I've been really lucky recently to have received the School of Social Care Research Career Development Award, which will allow me to do some priority setting work with people living with dementia. So in health and social care research, we increasingly and rightly involve members of the public, patients, service users in research. But it often happens a little bit too late, after decisions on what research should focus on have already been made. So this will be a chance to kind of give people living with dementia who use social services or receive social care support a chance to have a say on what research priorities are. So I'm really excited to start that work in January next year.